Here we see Sarcoptes scabii. This is the mite that causes human scabies, an extremely itchy infestation that's fairly common, and it's spread from person to person. Today's tutorial from Online Derm Clinic will be about human scabies infestation. I'm Dr. Chris Schock.
So let's talk a little bit more about scabies infestation. Well, it's caused by the human itch mite known as Sarcoptes scabii. Now that's only spread from person to person. We don't catch this mite from animals. Dogs can have a scabies infestation known as sarcoptic mange, but that is a different mite. The mite burrows into our skin, it lays eggs, and it feeds. It's person to person spread, although the mite can live off the skin for about 2 to 3 days. The 7-year itch is another term for scabies because it can be difficult to diagnose, and it can go on for years in some cases if not treated. The mites feed on dissolved tissue, not blood, and it takes about 10 days for a mite to mature to an adult. Classic distribution involves the finger webs, wrists, underarms, and abdomen. The groin is often involved as well. From the time of infestation, it takes about 4 to 6 weeks to show symptoms with the first scabies infestation. If you catch scabies again, it may only take about 7 to 10 days to start showing symptoms. So here's an image of the classic scabies distribution: the axilla, the groin, the finger webs again, and wrists. Here's an example of a patient with scabies. Their wrists are excoriated. So we see the mite burrows into the skin, and then we scratch these areas. Here's the finger web involvement. Again, that's classic for scabies infestation. So a very itchy rash involving a good amount of the body with the finger webs. You need to think about scabies as a possibility. Again, some burrows on the wrist. And here's a classic scabies burrow. Usually we don't find them intact because they've been scratched. So how do you diagnose it? The clinical distribution usually gives scabies away, but severe itching, and certainly if there's a patient or family history of scabies, we need to consider that. The burrows, if found, can help make the diagnosis. We can also do a scabies prep, which is a simple scraping test in the clinic where we look for scabies mites, eggs, or Scybala, which is the feces from the mite. In infancy, it can have a different presentation. In fact, an itchy rash with pustules included on the palms and soles should make the physician think of scabies. Here's a scabies prep showing Scybala, and the arrows highlight the Scybala. So what do we do about it? Well, the most common treatment that we use today is 5% permethrin cream, and it's applied from the jawline all the way to the toes, making sure that the fingernails are cleaned and the medication is applied under the nails. This is usually left overnight, and in the morning you bathe, wash away the cream, as well as do your laundry, do your linens. Vacuuming the home with disposal of the vacuum bags on that day is important, and the permethrin cream should be repeated in 7 days. There's an oral medication called ivermectin, can be used in more resistant cases. 1 dose at 200 micrograms per kilogram, and that's repeated in about 12 to 14 days. All family members in close contact should be treated as well, and it's best to treat people in a synchronized fashion. Everyone should be treated on the same day.